The uterus of the woman is divided into three layers, and the topmost layer is a layer upon which the fertilized egg is embedded or it stays. Now, this layer is known as the endometrium. Now, this endometrial layer has cells or tissues that are unique to it for conception. Okay, but sometimes these unique tissues or unique cells tend to grow outside that region, leading to a condition known as endometriosis, and this condition could go on to lead to complications including infertility, and that is what we want to discuss in today's video. Hi beautiful people, welcome back to the channel. If you're someone for the first time, you're welcome. My name is Yolona and I am a registered nurse, registered midwife, as well as a professional makeup artist, and over here we discuss all things faith, health, beauty, as well as nursing. So if these are the kind of contents that you are looking out for, please do not hesitate to like, to share, as well as subscribe. I said earlier that in endometriosis, the cells of the endometrial layer are now wrongly placed or located. Now, other regions of the body that you could find it are the peritoneum, the myometrium, which is the muscular layer of the uterus or the womb. You could also find it in the fallopian tube as well as ovaries. Now, this condition is common among women and it's usually diagnosed in women when they're in their 20s or in their 30s. Now, let's look at the symptoms of this condition. Usually, you will find extremely painful menstrual cramps in women who experience this condition. I mean, the kind of menstrual cramps that requires intervention. Most times there could also be abdominal pain or lower back pain. Sometimes you will have dyspareunia, which is painful sexual intercourse. There is usually heavy bleeding or spotting, which is light bleeding. Now let's look at the cause of this condition. The cause of this condition is idiopathic, meaning the exact cause is unknown, but it's usually been linked to genetic factors as well as family history. Now, what are those risk factors or those things that you have or experience that predisposes you to coming down with this condition? If you are nulliparous, meaning if you've not had kids before, you are predisposed to this condition. Yes. Early menarche as well is one contributing factor. What I mean by early menarche is if the first time as a young lady, girl, that you saw your period was at a very early age, then you are at risk. If you also experience heavy bleeding, if you have low body mass index, all this predisposes you to having this condition. If you have low estrogen levels as well, you're predisposed to having this condition, as well as family history. Now, for complication, the major complication we have as regards this condition is infertility. Now, how do we diagnose this condition? This condition can be diagnosed through imaging tests, through laparoscopy, as well as Now let's discuss treatment. Unfortunately, this condition doesn't have a cure, so whatever treatment modalities that are out there, they are just geared towards addressing the symptoms, bringing the symptoms to a minimal level for such individuals. That is why pain relief is usually given. Pain relief is given because extreme painful menstrual cramps is experienced by such women, and so the pain relief of choice usually the non-steroidal anti-inflammatory drugs to help combat the pain. For example, you have the ibuprofen. Also, hormonotherapy could be started out because bleeding, I remember I said that is one of the symptoms that such women experience. So these hormonal drugs help to combat the heavy menstrual bleeding. Birth control pills are some of the examples that could be given. Surgical intervention could also be done. If these cells are growing outside the endometrial layer, for example, they are found in the ovaries, then surgical interventions to take out the ovaries can be done. But it's usually done in women who do not want to have kids at all or no longer want to have more kids. But one thing I would say is, with menopause, these symptoms tend to reduce. That's if you want to wait till menopause. But women who are at the menopausal phase of their life, they have these symptoms but at a very, very reduced level. And with that, we've come to the end of this video. I hope I've been able to educate us and give us every useful information as regards the condition endometriosis. So let me know in the comment section below, are you experiencing this condition and what has been your treatment modalities that you are currently on as regards this condition? You never can tell. You can be helping a sister out there. All right, we learn everything. If you have any questions or recommendations on this topic, please let me know in the comment section below as well. Until I see you next time, bye lovers and hoppers.